Hello, Dr. Hashmi here. I am just a psychiatrist. This video is a part of my series on ADHD throughout life. I am talking about adolescents with attention deficit hyperactivity disorder in secondary education. This video is about the association of depression and anxiety amongst this lot. When an adolescent enters the secondary education, whether it's a boy or a girl, they are expected to organize themselves better than primary education. Children with ADHD cannot do that. They find it hard to sustain attention and concentration and unable to complete a task. It is very frustrating for them, being quite intelligent, to see other children completing tasks quite effectively, and they themselves, even with all the good abilities and qualities and a high level of intelligence, unable to complete the task. This generates huge amount of frustration and anxiety in an adolescent. You won't believe it, how difficult it is for an adolescent to cope with that frustration and anxiety of not being able to complete a task when they see everybody else is doing it. Now this itself is quite a reason to develop depression and anxiety. And that's exactly what happens. Most parents who take their adolescents to psychiatrists, starting from the doctors, are due to them suffering from depression and anxiety, not because of ADHD, because that is when they see that their adolescent, 14, 15, 16 years old, is unable to sleep, appetite has gone down, losing interest in work, school performance is on the downward drift, not performing at all, teachers complaining, everybody is branding them as naughty, to be very honest, someone who just cannot cope with the secondary school education, knowing the fact that they have known their child as a very young, intelligent boy or a girl, son and a daughter. But now what they see is school has become an issue. Sometimes it comes with school refusal. Now the hyperactivity element sometimes exclude these children from their social circle because they are in habit of blurting out their answers, blurting out the conversation. They can get into a group and they are so hyperactive, so elated, and they talk so much that the other kids feel just not connected with this kid, and they exclude the adolescent out of that group. That itself, again, quite enough to hurt or destroy someone's ego and confidence. So what parents see in a 13, 14, 15 years old, 16 years old is lack of sleep, lack of interest in activities, appetite is affected, the young person has become more groggier, angrier, difficulty waking up in the morning. There is a whole change in set of behaviors. Actually, the change in personality, parents see that our son, our daughter, she's just not the same. What happened to her? What happened to him in the last 3 months, 6 months? And that becomes the reason to take them to the doctors. And what they get is a prescription. Very commonly, they get a prescription of an effective antidepressant, which helps in reducing anxiety, which helps in making sleep better, which helps in improving some appetite. But the improvement is always limited. Why? Because the actual reason is not addressed. The reason for becoming depressed and anxious is attention deficit and hyperactivity, not actual depression and anxiety in its own right. These symptoms of depression and anxiety are actually the presentation signs. They are secondary to attention deficit and hyperactivity. Hence, antidepressants can help, but only limited. So whenever a young person, an adolescent in a secondary education develops depression and anxiety, always try to look for attention deficit and hyperactivity or autism, which obviously I'm going to talk about in my another set of videos. Always look for attention deficit and hyperactivity. Ask about the school, ask about the social circle, ask about their school performance, ask about whether they are able to maintain concentration, whether they are able to task complete, are they sleeping all right, are they organized in their lives, are these children not unnecessarily losing their personal belongings, are they punctual, waking up on time, all these things, are they getting ready efficiently in the morning, all these things are a part of it. Are they able to understand and comprehend what's being said and talk to them? All these things are important. Look for implicit hyperactivity. One thing I must say, hyperactivity a lot of times are expressed physically. In boys it is expressed physically more than girls. In girls it's more of implicit expression, where doodling on a piece of paper or playing with a hairband or any band or a finger ring. All these things are important, but most importantly, psychological hyperactivity. What they are going to talk about is, my head is full of thoughts. I cannot manage the amount of thoughts, unformed, ill-formed thoughts, where they can't make any connections. Sometimes the girls, adolescent girls with attention deficit, hyperactivity disorder, will hold conversation which you will see disjointed or out of context. It is just because of the excessive thoughts in their mind. When an adolescent, boy or a girl, develop depression or anxiety, look for attention deficit and hyperactivity. This might well be the reason for their secondary depression symptoms or symptoms of anxiety. Thank you very much.